Oh, I do like a bit of ABBA to kick us off. It is 10 here on BBC Radio Bristol. You're listening to Dr. Phil Hammond. It's my medical hour, and I'm delighted to welcome Dan Jeffries. Imagine, if you will, what it's like to live with one of the world's rarest medical conditions, and then to be told by doctors that you've got another one. That's what happened to Dan, who's written a fantastic book about his unique and astonishing journey. It's called Me, Myself and I. And I'm delighted Dan is with us. How are you, Dan?
Good morning. I'm very good, thank you.
So I guess the thing to do is to go back chronologically, because I think it's great that you've written this book, and it's a pretty weighty old book, isn't it?
It's a meaty tome, as people keep telling me.
476 words. Pages, sorry.
That would be a quick read otherwise.
I thought you're very kind. You've given me a copy of it. And let's go back chronologically, I guess. When did you first realise things weren't all well with you in terms of your health?
Okay, so I was about 3 or 4.
Okay.
My dad's partially sighted, and I think just as a matter of precaution, he wanted to make sure that my eyes were okay. And he took me to an optician. Optician looked in my left eye and noticed this mass of enlarged blood vessels, which obviously wasn't normal. So he sent me to Bristol Eye Hospital. Bristol Eye Hospital did some more tests.
What year would this have been, roughly?
So about 1981.
Okay.
They did some tests, and we discovered it was a condition called wyburn-mason syndrome.
I had to admit, I'd never heard of that.
You're not alone, I promise you. Even the eye specialists. I mean, that's how my second diagnosis got diagnosed, and I'll come on to that in a bit. But yeah, so I went to...
So wyburn-mason syndrome was presumably described by somebody called Wyburn and somebody called Mason.
Yes, they were the people that discovered it.
And there haven't been many cases since?
No. Well, as far as I know, and what I was told, there's been about 30 cases in the last 50 years worldwide.
Blimey.
Which I worked out as a stats, and I can't remember what that is now, but it's in the billions. So
it's obviously a very rare condition. Did it affect just the vascular system in your eye or all over your body?
It's primarily around the eye and the midbrain.
Okay.
So it has different effects, and one of them is visual impairment.
Okay.
So I am short-sighted in my right eye as well, but I can see fine in that. But the left eye is completely blind. No light, no shadows.
For
nothing.
How many years since you were...
Since I can remember, to be perfectly honest. So I've had to adjust throughout my life, basically seeing, with no left-hand side. So it had its challenges, but you get to live with what you know, don't you? So,
yeah, the human brain is amazing at adapting, isn't it, I guess? As human beings, we're pretty resilient, but also when there's damage to the brain, often other parts of the brain compensate. But you say on your right eye, you have short-sightedness.
Yeah, so I'm about -7 on my right eye.
Oh,
so.
Okay,
yeah.
So how did your parents cope with this? It's always difficult, isn't it, when you get a diagnosis, you find your kid is... But to have such a rare syndrome... And I guess in those days there wasn't the internet to look things up on either.
Exactly. So, I used to have to go to the eye hospital once a year. I mean, they were primarily concerned about making sure my right eye didn't lose vision and that this condition didn't transfer across.
And did they give you any treatment to stop that, or was it just...
No, it was just luck? Pretty much. I mean, there was nothing that they could do to cure this or fix this, because nobody wants to go and fiddle with blood vessels around the brain. So,
and even today, since 1981, obviously we've had lots of advances in medicine, but even today there's no particular treatment. There's no laser that can...
No.
Okay.
I've asked. I'd love to get my sight back, but it's not going to happen.
Okay.
When you see an X-ray of the eye, that's one of the things in the book. I've got images of X-rays and pictures, and you just see this massive blood vessels, and they are known as worms because they are just huge.
Wow.
So
that's pretty scary in itself. And in terms of the blood vessels proliferating around your midbrain, did they cause you any problems as far as you know?
No, I mean, again, that's what they were keeping tests on, but I have a feeling that it may have affected and caused my condition that I got when I was 30.
Okay, so if having that wasn't bad enough, you grew up that, you learnt to adapt with only seeing partially out of one eye. And in terms of your child, was it a happy childhood?
Yeah, it was great.
Because you don't want to be defined by your disease. You want to be a kid growing up and having hobbies and enjoying yourself every day. What did you enjoy doing when you were
Well, I tried to do sports, like all kids do. I used to find things like short tennis or tennis really difficult because I had no concept of where the other side of the court was.
Yeah, I can imagine that's hard.
But I was fantastic at snooker, and I think that's because I had such a straight line of vision that, like, looking down the cue, I wasn't distracted by anything else around me. So I actually played sort of league snooker when I was 10 and 11 in
brilliant?
Western. So yeah, that was really useful. And actually, I used to play pool tournaments against kids much older than me and whoop them. And it was.
And when you think about what you wanted to do with your life, what were your thoughts?
Well, my big interests were drama and theatre. I mean, I loved acting when I was a kid, and I went to QEH in Bristol, so just around the corner. And
Did you perform in their theatre? They got a little theatre there.
Yeah, well, they built that when I was there, and I actually performed in the very first play ever produced there in about 93.
Okay.
But because of my condition, I was, I think, probably the only boy ever to be excluded from playing rugby. Which for me was absolutely fine. I had no issues with that.
Big burly boys bashing into you.
No, that was the whole point. So I did drama and theatre and badminton and.
So you enjoyed your school. You thrived even though you had this disability.
Yeah, absolutely. I didn't see it as a problem because, like I said, I'd just grown up with it forever. So I was totally used to it.
So we've got you there. We've got you to school. Then symptoms of another disease appeared. We're going to find out what that was after we've heard from a bit of Men at Work. There you go, a bit of Men at Work and Down Under. You're listening to BBC Radio Bristol, 18 minutes past 10. It's our medical hour, and I've been talking to Dan Jeffries, who we were discovering was born with one of the rarest medical conditions imaginable, wyburn-mason syndrome, which caused proliferation of blood vessels in his left eye, which made him blind, and then he has quite severe short-sightedness in his right eye, which is pretty much enough to be going on with. Had a happy childhood and growing up in school at QEH here in Bristol. When did you realise you might have other medical issues as well? When did that kick you in the teeth?
Quite literally, funnily enough, actually.
Oh.
Well, I was in my 20s. I'd moved back to Bristol. I went to university at Canterbury for 4 years.
What did you study?
Drama and theatre studies. And those years were absolutely fine. And I moved back to Bristol in about 2002. I started to get really bad nosebleeds. And I'd always suffered with nosebleeds, but these had come on quite badly. And I went to an ENT specialist, and I had a septoplasty to straighten the septum. Didn't really stop, didn't sort anything out. And I just started to feel very lethargic. I used to write a lot of music. I was losing my creativity. The girlfriend I was with at the time didn't really have much bedroom interest, let's put it like that.
You lost your desire.
I was.
Which is pretty unusual in a man in his 20s.
Yeah,
right.
And I couldn't really calculate why this was.
Okay.
And all of these things, I was also starting to change physically as well. People who I hadn't seen for quite a few years didn't really notice what I looked like. Wow. Or they didn't recognise me.
What did they say had changed?
Well, my head had gotten bigger, and just my facial features had kind of thickened and grown outwards.
Okay.
And I just didn't look like I did when I was 18.
So there appeared to be another diagnosis waiting to be made. Who was it who made it?
So this is really bizarre.
Okay.
But basically, Bristol Eye Hospital got in touch with me and said, we've got some final year students. Because of your incredibly rare eye condition, can you come in and they'll try and diaggnose you as part of their exams? So
See if they can get wyburn-mason syndrome.
Yeah,
no
exactly.
No chance.
1 out of 5 got it right.
Really?
Yeah.
Okay,
I was very impressed with him. So anyway, I'm sat there in the chair, and the examiner brings in the first student, and he says, right, here's the patient, what do you see? And before they even looked in my eyes, they looked at me, stood back and looked at me and went, well, he's got very large hands, protruding jaw, exposed forehead. And the examiner was like, why do you think that might be? And they all said, could be due to excessive release of growth hormones due to a pituitary adenoma. And I'm sat there thinking, I don't know what that means.
No.
They've got it wrong. And then the second one said it, and then the third, and then the fourth. And I'm starting
There's
to
a
think,
pattern emerging here.
I think
Did they mention acromegaly as a...
Well, I basically, at the end of it, said, I've never heard anything of this before. And the examiner said, you should go and see your doctor. You might have something called acromegaly. And I jumped out my chair, left the hospital, typed it into Google, read the symptoms.
And it fitted you.
And I just was like, that's it. I knew that's what I had.
Is the acromegaly in any way related to your other, the wyburn-mason syndrome? Is there an association with them? Or?
They've not confirmed or denied that, but I would think it'd be unlikely if it wasn't. But I don't think it's a direct link. I think I'm just incredibly lucky or unlucky, however you want to see it. So I went for blood tests, and it showed that my growth hormone levels were kind of off the scale. And then further MRI scans and angiograms. The big concern was because they had to remove the tumour by going through the nose, all of these massive blood vessels from the wyburn-mason were going to be in the way.
Yeah. And also pituitary tumours are generally around the area of your optic nerve. So if that's not bad enough, having lost one eye, the other eye is under threat as well.
Well, when they removed the tumour, a few days later I started to get really blurred vision on the right-hand side of my eye. So I was lying in my hospital bed and all I can see is this like grainy sort of like television effect. So I have lost vision on my periphery and the right-hand side of my eye. So my field of vision is now even narrower.
Tunneled in a bit. I have to say, you're amazingly articulate and funny and positive about it, but presumably at the time you were thinking, you know, I don't know whether a God exists, but to hit you with this isn't fair.
I'm very stoic.
You do occasionally see patients who are unbelievably unlucky, and they do seem to pick up, 2 or 3 really serious diagnoses, and that's not fair, is it?
I think.
How did you cope with it
psychologically?
psychologically?
I guess coping with the wyburn-mason since being a kid and all of the things that threw at me at life. I did have. I tell you what it was. When they told me about the acromegaly, I was actually over the moon because it explained why I'd been feeling like I had. Okay. It wasn't just me feeling rubbish. There was a medical reason for it. And once they removed the tumour, it was like a plug had been lifted from my soul, and I was alive again.
Did you then find that your head shrank back a bit and your hands were
my
quite
features
suspended,
shrank back? I mean, I've got pictures of before and after, and my facial features do return. My feet had actually grown 2 sizes. Okay. So that had returned.
And how about your libido? Because that's probably the most important thing to a man in his 20s. Does that come back as well? Or
yes.
So do you have any treatment for that?
Yes. So I have an injection.
What's the injection called?
It's called Libido.
Libido for your libido. They're very clever, aren't they, drug companies? It's testosterone, is it?
Yeah, so it's a big, chunky injection of testosterone every 10 weeks.
So you can now enjoy the finer things in life?
Yeah, and that side of thing is great, but also it's given me confidence and... it's a big boost every 10 weeks.
I don't wish to dwell on your medical history, but reading your notes here, it said that in addition to having this tumour removed, you then had to be rushed back to hospital with meningitis.
So once the tumour...
That's a hell of a Venn diagram.
This is why it's such a good story, you see.
I can see why it's 600 pages long now.
It's basically when they do the operation to remove the tumour, they go through the nose, and I had something called a spinal fluid leak.
Okay.
And that got infected.
So you had meningitis.
I had to come back in for 2 weeks, lumbar drain, all of that, and then they had to go back into the nose and patch it all up again.
Blimey.
Yeah, and that's not the end of it. There's still more. I mean, the effects of what the side effects after that, my teeth and my heart and things like that. There's that's had big repercussions as well.
What's amazing about your book is not only is the book very long, but there's an app that you can get where we can download all your medical records, photos of your brain scans. That's a really clever idea, isn't it? Because obviously putting all those photos in a book makes it prohibitively expensive. But people can then go online. So you've actually tracked down all your medical records. Something I say this to audiences all over the country. I say how many people have read their medical records, how many have looked at them, and it's. Even in MPs and captains of industry, very few people have actually taken responsibility and looked at their records. But actually, in terms of understanding what happened to you and telling your story, it's fundamental, isn't it?
It was crucial, and it filled in a couple of small holes that I didn't know about. And just reading the correspondence between the experts prior to surgery, for example, was enlightening. So, there's a website...
But you weren't copied into that at the time, because now the best practice is that nothing about me without me. So the best practice now is anything written about you by any expert about you should be copied in.
Post-surgery, yes.
But before that, they were saying, my God, this could go either way.
Some little bit. So it's also the technical things that they don't copy you in on as well. So, but I have got most of it, and it's really helped. So, yes, in the book in the website, there are things like MRI scans and correspondence, but also music and video and before and after pictures. So it just makes for a bit more of an enriching story.
Tell me about your life now, because one of the things that amazes me about people who've really been through the mill is their resilience, their bounce-back ability.
Yeah.
So you've told this story. Was it, I don't know, whether cathartic or therapeutic in some way to tell it?
To a degree. I've told the story so many times over dinner parties and things like that. So I completely knew what I wanted to write. Getting the medical notes was a degree of catharsis because it opened up my eyes to a few things. But it's been a fantastic journey, and I've kind of project managed the whole thing, from the ebook to the Kindle book to the website to the production of this to the Kickstarter project, doing all the marketing and promotion myself whilst doing a job at the same time. It's a big thing, but I've loved it. I love it.
But it's also helpful. One of the things I've noticed, the things, I guess, how things have changed culturally since you were first ill. I mean, I remember in the 80s when I was a medical student, often we wouldn't tell patients if they had cancer. Some patients we thought they didn't want to know. We wouldn't tell them if they had motor neuron disease or multiple sclerosis or dementia. And now, not only do we tell people stuff, but although doctors think, confidentiality, mustn't share anything. Patients willingly access their records, their notes. They go into chat rooms. They help other patients. They share information. There's a really useful role, isn't there, of patients helping other patients. So you might not meet another person with your very rare wyburn-mason syndrome, but the story of what you've been through, getting your records, the transparency, coping with a serious illness is useful to other patients.
I'm part of a couple of acromegaly forums or pages, groups on Facebook, and you see people on there that are helping others that are currently going through it. And I've been able to sort of push the book a little bit on there and talk about this interview and just give people the opportunity to hear other people's stories, because I think that's fundamental to supporting your own journey and knowing that you're not alone in this. With the wyburn-mason, I've yet to meet anyone that's got that.
Well, we're putting anyone got wyburn-mason syndrome listening to this, give us a call, 0345 905 949. And as well as publishing this excellent book, what else are you doing with your life at the moment?
Well, I've got a busy day today. I've got a book signing at Waterstones this afternoon.
Get down there, the one in
the galleries.
In the galleries at 1 p.m. You'll be there signing and chatting about it?
I will. So it'll be excellent to see anyone that wants to come and get themselves a signed copy. Perfect for Christmas, I would add.
It is a good Christmas story, isn't it?
Yeah, and I want to try and go back to writing some music now, and now the book's kind of settled down a little bit, go back to releasing some tunes.
So how long did it take you start to finish?
About 2 years, 2.5 years. I worked with a copy editor in Amsterdam, and we did a lot of it online on Google Docs and things like that. So
what I noticed reading through it's really good because you don't duck any issues, stuff that's important.
Oh yeah.
Such as we talked about being able to have relationships and sex drive and stuff. You've all written about it in a very frank and open way. So it'll be really. There's a lot of men out there suffering from erectile dysfunction, for example, who'd find it really.
Exactly.
The fact that you can write about this stuff and not be ashamed or embarrassed by it is really important.
Thank you. And it's an easy read. It's funny as well. So that's the key.
And that's it. It's Me, Myself and I, a memoir by Dan Jeffries. It's out now. Bristol Publishers, Tangent Books, just for a tenner for all those pages and the app. And you can go down and see Dan at Waterstones at 1 p.m. if you bootle on down there. Now, we're going to be talking about bionic hands after the travel. But to take us to the travel, here's Charlie Pugh and Meghan Trainor with Marvin Gaye.
Let's Marvin Gaye and get it